Today's guest is Kay-Diene Robinson, MPH, a passionate advocate and proud sickle cell warrior. After being asymptomatic of sickle cell disease through a bone marrow transplant in 2015, Kay-Diene has dedicated herself to patient advocacy. As a community health worker and board member of the pain community, she educates medical professionals on sickle cell disease and emergent therapies, which we're going to get into today. And her mission is to guide others in the sickle cell community towards healing and purpose, inspiring them to discover their own why. So, Kay-Diene, thank you so much for coming on. I'm really excited to be able to learn so much from you and gain insight in terms of the experience that you've been through and also just for your advocacy work and education. I mean, I have my work cut out for me. I want to learn so much for you in the next 20 minutes.
No problem. And it definitely was not asymptomatic. Let's be clear. We were very not asymptomatic at all. Very symptomatic. So, yeah.
Okay.
So,
So,
yeah.
but in terms of after the bone marrow transplant, have you had symptoms?
Oh, symptom wise, no. Symptom
Okay. Okay.
regarding no. But complications related to transplant, yes.
Okay. So we'll get into all of that in terms of what led up to that and everything. And I think one aspect that I think about is newborn screening has been, I think, a game changer within the sickle cell community. All 50 United States, the District of Columbia, and US territories screen for sickle cell disease now as part of the newborn screening programs. And these screenings help detect sickle cell disease and other hemoglobinopathies early and really allows for timely intervention and treatment to manage the condition and improve outcomes for
Mhm.
infected individuals. So, were you screened through newborn screening and were diagnosed from that? Is that where the diagnostic kind of not really journey because it kind of ended with that, but is that where your experience with sickle cell started? I mean, obviously you wouldn't remember as a baby, but from what your parents have shared with you.
Sure. So no, I was not screened through newborn screening. My mom knew that her and my father had the trait. So at my 2 month checkup, granted, this is in 1999, 1989, so keep that in mind.
Sure.
At my 2 month checkup, she brought it up to my pediatrician that, hey, me and my partner, we have the trait. Can you test her for the disease? And they were like, sure, no problem. And at my 4 month checkup, um, she had asked for the results because they didn't give them to her right then and there. And so after waiting time, that's when they told her I had sickle cell. So newborn screening, even though it was approved, I was not screened during newborn screening.
And that's so frustrating that even just from the beginning of getting the diagnosis that wasn't given to your mom right away. It's like
She had to
what
ask,
a
like, what was
yeah.
the results?
Like she had to ask for it. It's like, oh yeah, that was probably in your physical file back then
Yeah,
and everything. And they're like, oh yeah. So already that must have been challenging for your mom in terms of just like, wow, like, do you even care in terms of like, you didn't even tell me the results. So I'm sure just with that interaction with that healthcare provider, it was already started out on a bad note. I would have been very angry in terms of like, when would you have told me if I didn't ask?
true. And I think it was more so just the time. And I wouldn't say it was so much the provider. I would put more emphasis on like the system as a whole at that time because I don't think everyone knew or it was common practice to ensure that, all babies were newborn screened, even though again it was available at that time. So I just think it was the timing, 1989, you know, we're still in a world of like not knowing really how this whole healthcare system really works and is it newborn screening okay? Like it was I would contribute it to the times, honestly.
Hmm. Yeah, and certainly in the years since, it's
Yeah,
changed a lot.
for sure.
And tell me more about growing up with sickle cell and what that experience was like in terms of if you knew other people and you had other people as you're growing up that also had sickle cell, or what was that like? Did you have a sense of community?
Um, not Really? So because I now was at the point where I was connected to a good pediatrician, and my pediatrician, hooked me up with a great provider um within the now it's North Beth Israel Barnabas Health System. But back then I was going to St. Barnabas, and within the St. Barnabas community, we had a lot of community, and it was more so we'll see each other at camp. We'll see, each other when we go to, our appointments. But as far as like connection and having conversations, not so much. But again, we're kids, so we don't really even know, like, hey, what do you guys, you have cancer, sickle cell, because it was a hospital clinic that saw everybody within the hematology oncology space. So we'll see each other at camp, we'll see each other at our appointments and maybe talk, maybe not. But as far as like having one-on-one talks with people who had sickle cell, no, there was none of that. And it wasn't until I got older and transitioned, granted not transition because I didn't have any transition care, but got into after my first real severe um medical um emergency, we'll call it that. That's when I moved back to New Jersey from Orlando and really found community, found connections at 23. And so that's when my community came into play. That's when we started to connect with the Sickle Cell Association of New Jersey and became volunteer, peer leader, and all the things. So yeah, as a kid growing up into early adulthood, those years, no community, and then bam, community at 23.
How did that feel at 23? That's, early 20s is a very challenging but fun time in life for most people. How was that to suddenly have a community after not having one? Was it an experience where you're like, wow, I wish I had this longer and I wish I had this as a kid?
I do. I really felt like had I, had someone in my teenage years, even if I was bouncing back and forth, Jersey, Florida, having, friends and peers that were going through the same things that I was going through really would have helped, at least bounce ideas off of, treatment options off of. Granted, there was not a lot of treatment options during that time other than hydroxyurea. So, just ideas of what, coping mechanisms are you doing, distraction techniques, like what's helping you get through. That would have been helpful, but having it at 23, better late than never. Because I genuinely feel like once I had my community, it became more of a let's come together moment and let's really try to get as much knowledge and exchange of knowledge between, fellow sickle cell warriors, and just going to even seeing outside of New Jersey what all is there for us, in other states across the nation, and what they're doing, and how you're living in your part of the world or in your part of the state or the country working for you versus where I'm at in New Jersey. So it was definitely a time where I wish I did have, but I'm glad I have it now.
And you mentioned learning about different treatments and kind of what was available at the time. And for those that are not as familiar with sickle cell, I'm sure you'll share more as we chat here that a lot of people experience these pain crises.
Mhm.
And what were the options at that point in terms of managing the pain? What was your approach? You kind of mentioned some ways of mentally approaching it, but also the medical treatments. Can you explain more of what your experience was with these pain crises and what was available to you at this time?
So at that time, that's when I finally started taking hydroxyurea, because I wasn't taking it up until that point at all. And then outside of that, it was just narcotics and NSAIDs. And it's like, okay, well, that's it. That's all. Like, there's no other real treatment options specific to sickle cell. And of course, with narcotics, you develop a pain tolerance, and your tolerance is not, 2 milligrams worked before, now it doesn't. So you're having to go up, 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 up. And of course, with that, they also try to increase the hydroxyurea to figure out what balance can we create with, you know, taking your hydroxyurea and making sure your levels are where they need to be so that you can feel the effects of it, but also realizing that, hey, this does not work for me. Like, this is not a medication that, yes, it may work for many of others, but for me specifically, it does not. So not having a lot of other options outside of just, hey, I'm in pain and I'm in crisis and I need to go to the hospital. Yes, I'm trying my best to not have to go, but I'm at the point where I have no choice.
Thank you so much, Kay-Diene. This has just been
Mhm.
really informative, and thank you so much for being so open and sharing your journey because as you mentioned, it helps so many people to hear what you've been through, the kind of decision processing you were making. And thank you for all of your patient advocacy work and the ripple effect that you're having in the sickle cell community. Thank you so much, Kadeen.
Thank you so much for having me. It was a pleasure.